As we age, maintaining good health becomes a bit more challenging. One of the most commonly overlooked aspects of elderly health is vitamin B12 deficiency. While this vitamin is essential for many critical functions in the body, such as nerve health, red blood cell production, and DNA synthesis, older adults are particularly at risk of developing a deficiency. The problem is that many symptoms of B12 deficiency are subtle and easy to dismiss as part of the aging process. In this video, we'll explore the causes, symptoms, and treatment options for vitamin B12 deficiency in older adults. If you're over 60, this video is crucial for understanding how this deficiency can affect your health and what you can do to address it. Part 1. Causes of vitamin B12 deficiency in aging. As we age, our bodies undergo numerous changes that can impact the way we absorb and utilize nutrients. One of the most common deficiencies seen in elderly individuals is vitamin B12 deficiency, which can lead to a range of serious health problems if left untreated. Vitamin B12 plays a crucial role in nerve function, red blood cell production, and DNA synthesis, and a lack of it can lead to symptoms such as fatigue, memory problems, and even neurological issues. While vitamin B12 deficiency can affect anyone, it is more common in older adults due to several factors that disrupt the body's ability to absorb or use the vitamin properly. In this section, we'll explore the main causes of vitamin B12 deficiency in aging, shedding light on why seniors are particularly at risk and what steps can be taken to address the issue. 1. Reduced stomach acid production. One of the most significant reasons why vitamin B12 absorption decreases in older adults is reduced stomach acid production. As we age, the stomach's ability to produce hydrochloric acid naturally diminishes. Hydrochloric acid is essential for breaking down the proteins in food and releasing vitamin B12 from food sources so that it can be absorbed into the bloodstream. In a younger, healthy digestive system, vitamin B12 found in animal products such as meat, dairy, and eggs binds with a protein called intrinsic factor, IF, in the stomach, which is then absorbed in the small intestine. However, as we get older and stomach acid levels decrease, this process becomes less efficient, leading to poor absorption of vitamin B12. Conditions like atrophic gastritis, a condition where the stomach lining becomes inflamed and thins, are also common in older adults, further reducing stomach acid production. As a result, even if an individual is consuming enough B12-rich foods, the body may struggle to absorb it adequately. 2. Gastrointestinal conditions and malabsorption. Many elderly individuals suffer from gastrointestinal GI conditions that affect their ability to absorb nutrients, including vitamin B12. Celiac disease, Crohn's disease, gastritis, and other malabsorption syndromes can all hinder the body's ability to properly absorb vitamin B12 from food. These conditions often cause inflammation or damage to the digestive tract, which impairs nutrient absorption. For example, celiac disease damages the lining of the small intestine, which can result in malabsorption of important vitamins and minerals, including vitamin B12. Similarly, Crohn's disease, which involves chronic inflammation of the GI tract, can also interfere with nutrient absorption, particularly in the parts of the intestine where vitamin B12 is absorbed. Additionally, surgical removal of portions of the stomach or small intestine, which may occur due to cancer or other GI issues, can reduce the surface area available for nutrient absorption, leading to vitamin B12 deficiency. Gastric bypass surgery, which is commonly performed to aid weight loss, also reduces the body's ability to absorb vitamin B12. 3. Use of certain medications. Seniors are often prescribed a variety of medications for different health conditions. However, some medications can interfere with the absorption of vitamin B12 and contribute to deficiency. Proton pump inhibitors, PPIs, which are commonly used to treat acid reflux, gastritis, and ulcers, work by reducing stomach acid production. As mentioned earlier, stomach acid is necessary for the proper release and absorption of vitamin B12 from food. Long-term use of PPIs and H2 receptor antagonists, another class of acid-reducing medications, can therefore lead to vitamin B12 deficiency over time. Similarly, antacids used to treat heartburn can alter the stomach's pH, making it more difficult for the body to absorb vitamin B12 from food. Metformin, a medication commonly prescribed for type 2 diabetes, has been linked to a decreased ability to absorb vitamin B12. While metformin helps regulate blood sugar levels, it has been shown to affect the small intestine's ability to absorb certain nutrients, including B12. Studies indicate that long term metformin use can increase the risk of B12 deficiency in older adults, which could contribute to symptoms such as fatigue and neuropathy, nerve damage. Other medications commonly prescribed to older adults, such as aspirin, antibiotics, and diuretics, may also interfere with vitamin B12 absorption. Long term use of these medications can increase the likelihood of developing a deficiency, particularly if dietary intake of B12 is not adequate. 4. Diet and dietary restrictions. Older adults are at a higher risk of vitamin B12 deficiency due to dietary factors. Poor diet, unbalanced nutrition, and food aversions can all contribute to inadequate vitamin B12 intake. Many elderly individuals have a limited intake of animal products, the primary source of vitamin B12, due to vegetarian or vegan diets, reduced appetite, or difficulty chewing and swallowing food. A vegan diet, in particular, is deficient in vitamin B12, as it is found only in animal derived foods. While plant based foods like fortified cereals or plant based milks contain synthetic B12, many people following a vegan diet do not consume enough of these fortified foods. For this reason, seniors on a vegan diet may need to take a vitamin B12 supplement. Additionally, seniors who struggle with poor appetite or difficulty preparing meals may not consume enough vitamin B12 rich foods. Seniors living on a limited income may also find it difficult to purchase fresh meat, dairy, and other nutrient rich foods. 5. Age related decline in intrinsic factor production. Intrinsic factor, IF, is a glycoprotein produced in the stomach that is essential for the absorption of vitamin B12 in the small intestine. As we age, the body's production of intrinsic factor tends to decline, especially in those with atrophic gastritis or other gastrointestinal issues. When intrinsic factor production is reduced, the body's ability to absorb vitamin B12 from food becomes impaired, leading to a deficiency. This decline in intrinsic factor production is particularly important because it makes the elderly more reliant on supplements or injections for vitamin B12. It's common for seniors to need B12 shots or high dose oral supplements in order to maintain healthy levels of this vitamin. Vitamin B12 deficiency in the elderly is a significant health concern, but it is often underdiagnosed or dismissed as part of the natural aging process. Several factors, including reduced stomach acid production, gastrointestinal conditions, medication use, and poor diet, contribute to the increased risk of deficiency in older adults. If left untreated, vitamin B12 deficiency can lead to serious health complications, including neurological problems, anemia, and cognitive decline. Fortunately, this deficiency can be easily managed through dietary changes, supplements, and regular monitoring by healthcare providers. Seniors should be proactive in addressing this deficiency by eating a balanced diet, consulting with doctors about any symptoms, and considering B12 supplementation if necessary. By staying informed about the causes and symptoms of vitamin B12 deficiency, older adults can take the necessary steps to protect their health and improve their quality of life as they age. Part 2. Symptoms of vitamin B12 deficiency. Vitamin B12 is a vital nutrient that plays a critical role in nerve function, red blood cell production, and DNA synthesis. A deficiency in vitamin B12 can lead to a wide range of symptoms, some of which can be severe if left untreated. While these symptoms can be subtle at first, they often worsen over time and may result in neurological problems, cognitive decline, and anemia. Understanding the signs of a B12 deficiency is crucial, especially for older adults who are at a higher risk due to factors like dietary habits, reduced absorption capacity, or certain medical conditions. In this section, we'll break down the common symptoms of vitamin B12 deficiency and why they occur in the body. 1. Fatigue and weakness. One of the most common early signs of vitamin B12 deficiency is fatigue. Vitamin B12 is essential for the production of red blood cells that carry oxygen throughout the body. Without adequate B12, the body struggles to produce healthy red blood cells, leading to anemia. Anemia can cause you to feel tired, weak, and low in energy. In the elderly, fatigue can often be attributed to aging or other chronic health conditions, so a B12 deficiency might be overlooked. However, if the fatigue is persistent or unusual, it's important to check for B12 levels as it may be the root cause. 2. Numbness and tingling, neuropathy. Vitamin B12 is crucial for the health of the nervous system. A deficiency can lead to nerve damage, which manifests as numbness, tingling, or a pins and needles sensation, particularly in the hands and feet. This condition, known as peripheral neuropathy, occurs because B12 helps maintain the myelin sheath, a protective covering around nerves that is necessary for proper nerve function. If left untreated, nerve damage caused by B12 deficiency can lead to muscle weakness, difficulty with coordination, and in severe cases, walking problems. It's essential to address these symptoms early to avoid long-term nerve damage. 3. Cognitive issues, memory loss, and confusion. One of the most concerning symptoms of vitamin B12 deficiency is the impact it can have on cognitive function. B12 deficiency can cause symptoms like memory loss, confusion, difficulty concentrating, and even dementia-like symptoms. This is because vitamin B12 is vital for maintaining the health of the brain and nervous system. In elderly individuals, these cognitive issues may be mistakenly attributed to normal aging or early signs of Alzheimer's disease. However, reversible cognitive decline due to B12 deficiency can occur, and proper treatment often leads to improvements in memory and mental clarity. 4. Pale or jaundiced skin. Vitamin B12 deficiency can affect the body's ability to produce red blood cells, leading to anemia. Anemia can cause paleness or even a yellowish tint to the skin and eyes, known as jaundice. This happens because of the breakdown of red blood cells, which releases bilirubin, a yellow compound that can cause the skin to appear jaundiced. If you notice a pale complexion or a yellowish hue to your skin, it could be a sign that your body is not producing enough healthy red blood cells due to a B12 deficiency. This symptom should be evaluated by a healthcare provider, especially if accompanied by other signs of anemia like fatigue or weakness. 5. Glossitis and mouth sores. Another common symptom of vitamin B12 deficiency is glossitis, which is inflammation of the tongue. This can make the tongue appear smooth, red, and swollen. The tongue may also become painful, making it difficult to eat or speak comfortably. In addition to glossitis, people with B12 deficiency may also develop mouth sores or ulcers. These sores can occur on the tongue, inside the cheeks, or the roof of the mouth. The inflammation of the tongue and the appearance of mouth sores are often early indicators that something is wrong with the body's vitamin levels. 6. Shortness of breath and dizziness. Because vitamin B12 plays a crucial role in the production of red blood cells, a deficiency can lead to anemia, which reduces the amount of oxygen delivered to your body's tissues. This can result in symptoms like shortness of breath, dizziness, and lightheadedness, especially during physical activity. In severe cases, individuals with untreated B12 deficiency may experience heart palpitations and fatigue as the heart works harder to compensate for the lack of oxygen in the bloodstream. If you experience these symptoms regularly, it's important to seek medical advice as they can lead to more serious complications if left unchecked. 7. Vision problems. Vitamin B12 deficiency can also cause vision problems, particularly blurred vision or even double vision. This occurs due to the impact of the deficiency on the optic nerve, the nerve responsible for transmitting visual information from the eyes to the brain. This condition, known as optic neuropathy, can lead to reduced vision or even blindness in severe cases. If you notice sudden changes in your vision or a loss of clarity, it is important to seek medical attention. Early detection and treatment of B12 deficiency can help prevent permanent damage to the optic nerve. 8. Mood changes and depression. Vitamin B12 plays a crucial role in the production of serotonin, the hormone responsible for regulating mood. A deficiency in B12 can result in mood swings, irritability, anxiety, and depression. In fact, many individuals with B12 deficiency experience symptoms of depression that can sometimes be mistaken for normal aging-related mood changes. These mood changes are due to the lack of neurotransmitters in the brain, which is exacerbated by B12's role in maintaining proper brain function. In many cases, treating the B12 deficiency can lead to an improvement in mental health and a more stable mood. 9. Heart palpitations. As mentioned earlier, vitamin B12 is essential for red blood cell production. When there is insufficient B12 in the body, it can lead to anemia, which causes the heart to work harder to pump blood and oxygen throughout the body. This increased effort can result in heart palpitations, an uncomfortable sensation of a fast, fluttering, or pounding heart. If you experience heart palpitations along with other symptoms of B12 deficiency like fatigue or shortness of breath, it's crucial to seek medical attention. This could be a sign that your body is not getting the oxygen it needs, and correcting the B12 deficiency can help alleviate these symptoms. Vitamin B12 deficiency is a serious concern, especially for older adults. The symptoms are often subtle at first, but can escalate and lead to significant health problems if left untreated. From fatigue and numbness to memory issues and vision problems, the effects of B12 deficiency can impact multiple areas of health and well being. If you or a loved one are experiencing any of the symptoms listed above, it's important to get your B12 levels checked by a healthcare provider. Early detection is key to reversing the effects of a deficiency and ensuring that vitamin B12 levels are restored to healthy levels through dietary changes, supplements, or injections. Part 3. Treatment for vitamin B12 deficiency. Vitamin B12 deficiency is a common condition, especially among older adults, and it can lead to a wide range of health issues if left untreated. Fortunately, it is a treatable condition. Treatment for vitamin B12 deficiency aims to restore normal B12 levels in the body, improve symptoms, and prevent long-term complications such as neurological damage and cognitive decline. In this section, we will discuss the various treatment options for vitamin B12 deficiency, including supplements, dietary changes, and medical interventions. 1. Vitamin B12 supplements. For most people with a vitamin B12 deficiency, oral supplements are the primary treatment. These supplements are available over the counter in various forms, including tablets, sublingual tablets, which dissolve under the tongue, and liquid forms. In many cases, seniors who have difficulty absorbing B12 from food will be advised to take high-dose oral supplements regularly. Types of supplements. Oral tablets. These are the most common and convenient form of B12 supplements. A typical dose may range from 500 to 1,000 micrograms daily, depending on the severity of the deficiency. For some individuals, daily or weekly doses are recommended until B12 levels are restored. Sublingual tablets. These dissolve under the tongue and are believed to be absorbed more quickly into the bloodstream, bypassing the digestive system. They are a popular option for individuals who have difficulty absorbing nutrients orally. Liquid supplements. These are another alternative for people who have trouble swallowing pills. Liquid B12 can be added to drinks or taken directly. Dosage. For mild deficiency, an adult may require 1,000 micrograms per day. For severe deficiency, higher doses might be recommended, potentially up to 2,000 micrograms or more per day, or as advised by a healthcare provider. Why supplements work. Oral B12 supplements are typically effective in increasing B12 levels in the body because they provide a direct source of the vitamin that the body can use. For most individuals, regular supplementation is enough to restore B12 levels and improve associated symptoms. 2. Vitamin B12 injections for individuals with severe vitamin B12 deficiency, those with malabsorption issues, or seniors who have difficulty absorbing B12 through their digestive system. B12 injections may be required. B12 injections deliver the vitamin directly into the bloodstream, bypassing the digestive tract entirely and ensuring immediate and effective absorption. Why injections are necessary? Absorption problems. Some individuals suffer from conditions like atrophic gastritis, pernicious anemia, or digestive issues that impair their ability to absorb B12 through food or oral supplements. Severe deficiency. In cases where symptoms of B12 deficiency are severe, such as nerve damage, anemia, or cognitive decline, injections may be required to rapidly restore adequate B12 levels. Frequency of injections. Initially, B12 injections may be given weekly or monthly depending on the individual's needs. Once vitamin B12 levels are stabilized, maintenance doses may be given every 1 to 3 months. How injections help. B12 injections work quickly because they deliver the vitamin directly into the bloodstream, allowing it to bypass the digestive system. This is the most effective treatment for people who cannot absorb the vitamin properly from food or oral supplements. 3. Dietary changes and food sources of vitamin B12. For those who are able to absorb B12 through their digestive system but need to boost their intake, making dietary changes is an effective way to prevent and treat B12 deficiency. Many of the richest sources of B12 come from animal products, which are easily absorbed by the body. Foods rich in vitamin B12, meat, beef, chicken, lamb, and liver are excellent sources of B12. Fish and seafood, salmon, trout, sardines, tuna, and clams are high in B12. Dairy products, milk, cheese, and yogurt provide B12 in easily absorbed forms. Eggs. Eggs are a great source of B12, especially the yolk. Fortified foods. For vegetarians or vegans, fortified foods such as plant-based milks, soy, almond, breakfast cereals, and nutritional yeast are good alternatives. For those who have dietary restrictions or follow a vegetarian or vegan diet, it's essential to consume fortified B12 foods or take B12 supplements regularly, as plant-based foods do not naturally contain B12. 4. Addressing underlying causes of B12 deficiency. In some cases, vitamin B12 deficiency is not only due to poor dietary intake, but also due to underlying medical conditions that affect absorption. Treating the root cause of the deficiency is crucial for long-term health. Common causes of B12 deficiency. Pernicious anemia. This autoimmune condition affects the production of intrinsic factor, IF, which is necessary for B12 absorption. In this case, B12 injections are often required since the body cannot absorb the vitamin from food. Gastric surgery. Those who have had gastric bypass surgery or other surgeries that affect the stomach or small intestine are more likely to experience B12 malabsorption. Chronic diseases. Conditions like Crohn's disease, celiac disease, and ulcerative colitis can impair nutrient absorption in the small intestine, leading to B12 deficiency. Medications. Some medications, like proton pump inhibitors, PPIs, or metformin, can interfere with B12 absorption. In these cases, regular monitoring and supplementation are necessary. If your vitamin B12 deficiency is caused by an underlying condition, it is important to work closely with your healthcare provider to manage the condition and prevent further deficiencies. In some cases, lifestyle adjustments or changes in medication may be necessary to improve B12 absorption. 5. Monitoring and follow-up. Once treatment begins, it's essential to regularly monitor vitamin B12 levels to ensure the deficiency is being addressed and symptoms are improving. Your doctor may recommend periodic blood tests to track your B12 levels and adjust your treatment plan as needed. Regular checkups. Blood tests. These tests help measure the levels of vitamin B12 in the bloodstream and ensure that supplementation or dietary changes are effective. Neurological exams. For severe deficiencies affecting the nervous system, your doctor may conduct a neurological exam to monitor improvements in cognitive function and nerve health. Vitamin B12 deficiency is a common issue, especially in older adults, and it can lead to serious health complications if left untreated. However, the good news is that it is treatable. Through B12 supplements, dietary changes, injections, and addressing underlying causes, vitamin B12 deficiency can be managed effectively, leading to improved energy, cognitive function, and overall health. If you suspect a B12 deficiency, it's important to seek medical advice and get your levels checked. With the right treatment, most individuals can recover from B12 deficiency and improve their quality of life. Vitamin B12 deficiency is a common issue in seniors, but it is often overlooked or dismissed as part of the aging process. If you're over 60 and experiencing symptoms such as fatigue, memory problems, numbness, or mood changes, a B12 deficiency may be the cause. Thankfully, it's relatively easy to treat with supplements, dietary changes, or in some cases, injections. By paying attention to your body and seeking early intervention, you can prevent long-term complications associated with B12 deficiency and maintain a better quality of life as you age. If you found this video helpful, don't forget to like, subscribe, and share with others who might benefit from this information. Stay healthy and stay informed with true senior wisdom.